Hello and welcome. Today we're diving deep into a relatively uncommon but important condition affecting the urinary system, ureteral polyps. We'll explore what they are, what causes them, how they're diagnosed, and what treatment options are available. So, let's get started! The exact cause of ureteral polyps remains somewhat of a medical mystery. However, several factors are thought to contribute to their development. These include chronic irritation or inflammation of the ureter, which could stem from recurrent urinary tract infections or the presence of kidney stones. Genetic predisposition may also play a role, making some individuals more susceptible than others. In some cases, polyps might arise as a reactive change to trauma or surgical procedures involving the ureter. And, although rare, some ureteral polyps can develop as a result of benign or even malignant tumors. Ongoing research aims to further unravel the precise origins of these polyps. When a ureteral polyp forms, it essentially creates a growth or mass within the lining of the ureter, which is the tube that carries urine from the kidney to the bladder. This growth can obstruct the flow of urine. The degree of obstruction depends on the size and location of the polyp. This obstruction can lead to back pressure in the kidney, a condition known as hydronephrosis. Prolonged hydronephrosis can damage the kidney over time, potentially leading to impaired kidney function. Additionally, the polyp can cause irritation and inflammation of the ureteral lining, further contributing to symptoms. Ureteral polyps are considered a relatively rare condition. Precise epidemiological data is limited due to the often asymptomatic nature of smaller polyps and the potential for misdiagnosis. They can occur in individuals of any age, though they seem to be slightly more prevalent in adults between the ages of 40 and 60. Men and women appear to be equally affected. It's important to remember that because many cases go undiagnosed, the true incidence of ureteral polyps may be higher than current statistics suggest. Many ureteral polyps are small and cause no noticeable symptoms. However, as they grow or cause significant obstruction, symptoms may begin to appear. The most common symptom is flank pain, which is pain in the side or back. This pain can be constant or intermittent and may worsen with increased fluid intake. Other symptoms include hematuria, which is blood in the urine, dysuria, which is painful urination, and frequent urinary tract infections. In some cases, if the polyp significantly obstructs the ureter, it can lead to hydronephrosis, which can cause nausea, vomiting, and even kidney damage. Diagnosing ureteral polyps typically involves a combination of imaging techniques. Initially, a urinalysis might reveal blood or infection. A CT urogram, which is a CT scan of the urinary tract with contrast dye, is often the preferred imaging modality, as it provides detailed images of the ureters and kidneys. An intravenous pyelogram (IVP), an X-ray of the urinary tract using contrast dye, may also be used. In some cases, a ureteroscopy, where a small camera is inserted into the ureter, may be necessary to directly visualize the polyp and obtain a biopsy for further analysis. While there isn't a strict classification system for ureteral polyps like some other medical conditions, they can be broadly categorized based on their size, location, and pathological characteristics. Polyps can be described as small, medium, or large, depending on their dimensions. Their location within the ureter, such as the upper, middle, or lower third, is also important. Pathologically, polyps can be benign, inflammatory, or rarely malignant. A biopsy obtained during ureteroscopy is essential for determining the polyp's pathological nature. Treatment for ureteral polyps depends on the size, location, and symptoms they are causing. Small, asymptomatic polyps may only require observation with regular monitoring to ensure they aren't growing or causing obstruction. For larger, symptomatic polyps, or those that are causing hydronephrosis, surgical intervention is typically necessary. Ureteroscopy with polyp resection, where the polyp is removed using instruments passed through the ureteroscope, is a common approach. In some cases, particularly for larger or more complex polyps, an open or laparoscopic surgical procedure may be required to remove the polyp and reconstruct the ureter. Regular follow-up is important after treatment to monitor for recurrence. Currently, there are no specific preventive measures known to completely eliminate the risk of developing ureteral polyps. However, maintaining good urinary health can potentially reduce the risk of chronic inflammation and irritation, which are thought to contribute to polyp formation. This includes staying well hydrated, promptly treating urinary tract infections, and addressing any underlying conditions such as kidney stones. Regular check-ups with your doctor can also help with early detection and management of any potential issues. The prognosis for ureteral polyps is generally good, especially when diagnosed and treated early. Most polyps are benign and can be successfully removed with minimal long-term complications. However, recurrence is possible, so regular follow-up with your urologist is crucial. Recent research is focused on improving diagnostic techniques, developing less invasive treatment options, and identifying potential genetic markers that could help predict an individual's risk of developing ureteral polyps. Further studies are also exploring the role of specific medications in preventing polyp recurrence.